What are common myths about cosmetic injections? Many people hear about cosmetic injections and immediately think of dramatic transformations or risky procedures. But there are quite a few misconceptions floating around that can lead to misunderstandings about safety and results. Let's clear up some of the most common myths so you can make informed choices about your skin health. First, some believe that cosmetic injections are unsafe and not worth the risk. In reality, when performed by licensed, experienced medical professionals, these treatments are very safe. Studies show that complications are rare, and most side effects are minor and temporary. Proper dosing and qualified providers are key to ensuring safety. It's important to trust trained professionals who follow strict medical guidelines. Another myth is that Botox is toxic and its long-term effects are unknown. Botox is derived from a purified form of botulinum toxin, a neurotoxin, but in cosmetic doses, it is very safe. It has been extensively studied and approved for use in many countries. When administered correctly, Botox does not cause systemic illness or toxicity. It stays localized at the injection site and does not travel through the body. Some think Botox can cause infections or spread throughout the body. But Botox is a purified protein complex that remains at the injection site. It does not cause infections or systemic effects if given properly. Its localized action is what makes it effective and safe for reducing wrinkles caused by muscle movements. Many assume cosmetic injections only target wrinkles. Actually, they serve many purposes. Besides smoothing dynamic wrinkles, they can add volume to lips and cheeks, improve jawline definition, and address under-eye hollowness. Different types of injections are used depending on your specific goals, and a professional can help choose the right treatment. There's a misconception that Botox will eliminate all wrinkles. Botox works best on dynamic wrinkles, those caused by muscle movements like frowning or squinting. Static wrinkles, which are visible even at rest, may need additional treatments like dermal fillers or laser therapy. Realistic expectations are important to achieve natural-looking results. Some believe Botox results are immediate. Actually, it takes several days to a week for the full effect to develop. The muscles gradually relax as the neurotoxin takes effect, so patience is key. Most people see noticeable improvements within 10 days. Many think cosmetic injections are permanent, but most results last between 6 and 12 months. After that, the effects fade, and treatments need to be repeated to maintain the look. This temporary nature allows flexibility and adjustments over time. There's also a myth that permanent fillers are better than temporary ones. Permanent fillers can carry higher risks and are less reversible if problems occur. Temporary fillers made from substances like hyaluronic acid are safer because they can be dissolved if needed. Some worry that Botox will make their face look frozen. When done by a skilled professional, Botox should subtly soften wrinkles without sacrificing natural movement. Overuse or excessive doses can cause a frozen appearance, but a qualified provider will aim for a natural, expressive look. People also fear that lip fillers will give them duck lips. When administered properly by experienced practitioners, lip fillers should enhance your natural shape without overdoing it. Swelling immediately after treatment is normal but subsides quickly, revealing natural-looking results. A common myth is that cosmetic injections will stretch your skin. If performed correctly, fillers add volume without stretching the skin. In fact, some fillers can stimulate collagen production, which supports skin firmness. When treatments are stopped, the skin returns to its previous state. Many assume injections are painful. In reality, they involve only brief discomfort similar to a small pinprick. Topical numbing creams are often used to reduce any pain. For those anxious about injections, discussing options with your provider can help make the experience more comfortable. Another misconception is that there is significant downtime. Usually, you can return to your normal activities immediately. Mild side effects like bruising or swelling may occur but are temporary. Some believe all cosmetic injections are the same. In fact, there are different types like Botox, dermal fillers, and others, each with unique properties and uses. Your doctor can recommend the best option based on your goals. Many think Botox and dermal fillers are interchangeable. They are different treatments. Botox relaxes muscles to reduce wrinkles, while fillers add volume and fill in lines. Both can be used together for comprehensive facial rejuvenation. Finally, some worry that Botox is addictive. There is no physical addiction involved. However, because the results can boost confidence and satisfaction, some people may become psychologically dependent on the look. It's always best to discuss your goals with a qualified professional to ensure safe and satisfying outcomes. Remember, the most important step is consulting a licensed, experienced dermatologist or medical provider. They can assess your individual needs, explain realistic outcomes, and help you choose the safest, most effective treatments for your skin health and aesthetic goals. Always prioritize safety and professional guidance when considering cosmetic injections.